AirPods I gave you, they good?
Do you always kind of get worried?
They won't even be bothered.
Won this election.
I don't think Kamala Harris was the most impressive.
Okay, everyone. We are resuming. The screen says we will resume shortly, and yes, now we have resumed. Welcome back. It's still wonderful to be here with all of you. So we are on the amendment that was proposed by Representative Mara. And is there further discussion on this item? Senator Onmore, to be followed by Senator Summers.
Thank you so much, Madam, I was going to say Madam President, but Madam Chair. Madam Chair, I wanted to ask another question from the proponent of the amendment. Rep. Mara, I wanted to ask you, are you aware that the third trimester abortions are only to be done in emergency in the state of Connecticut?
Yes,
And so if, and they're only to be done in an emergent situation to save a life of the mother?
yes, as the regulation states, no abortion may be performed upon a patient after viability of the fetus except when necessary to preserve the life or health of the patient.
So, and that's an existing law.
That's the existing law.
And so because what I heard you say was that the patient should have the abortion at the hospital. I'm trying to understand this again, because by definition, this is going to be an emergency and has to be at the hospital. So why is it that we have to, and it has to be done in an emergent situation, and it almost appears like your amendment is suggesting that it can be done without emergency.
I'm sorry, I'm not understanding what you're trying to state. If it's done to preserve the life and health of the patient is why you can do this. To make sure that at any time for the life or the health of the patient, that you're actually doing this in a hospital setting where there would be support for the fetus if it were born alive.
But your amendment is not stating that.
That's exactly what my amendment states. I will, all induced abortions after second trimester shall be done in a licensed hospital.
So that induced abortion, in my mind, would be done only in an emergent situation.
Okay, so if you find out that a child may have a genetic trisomy or something and is going to be at risk of dying, therefore the life of the mother may be at risk. If you find the mother has preeclampsia, look, I'm not an OBGYN, but I'm coming up with a few things off the top of my head. That they may not be exactly emergent. I'm not going to die right now, but I know that I'm going to need to have this baby induced because there's definitely issues that are happening, that the likelihood of the viability, the likelihood that my health is at risk because it's a third trimester. I need to make sure that I go to a hospital and have this done. I'm not going to go to an outpatient setting. I'm going to be in a hospital. And you're saying that for most reasons that should be done. And I agree. I would think that most of the reasons it should be done, but I just want to ensure that it is done, that if someone goes to an outpatient setting and they have they've had a risk for preeclampsia and they're there with high blood pressure, that they immediately go to the hospital, that an outpatient clinic or any sort of clinic that doesn't have an area to support the life of a child is not a facility that's used by that patient, that they're taken to the hospital. So while there may not be bleeding, or there may not be an exact emergency situation where they need immediate care, they're going to need care in the next 24, 48 hours, something like that, that they should make sure that they are at a hospital.
So the existing law, as I understood was that in the third trimester, it's going to be only permitted to be able to, in an emergent situation, to save the mother's life.
It doesn't say emergent situation. It says when necessary to preserve the life or health of the patient. So there could be instances where you would need to preserve the life of the health of the patient, in which is not an emergency.
Just bear with me. I'm trying to read what I have here. So, thank you for your answers. And my understanding is it's a very dire situation. It's like 0.1, 0.2% of the cases where this happens, but all of those cases have to be at the hospital, period. That's how I understand this, but
I appreciate that, but why? That's the why they would have to be at the hospital. One, maybe because it's absolutely emergency, but
Yeah.
the other is it's in our regulation. And I want to make sure that that continues to happen. So I agree. And I want to make sure that that continues to happen, because that's what we have in our regulations, because that makes the most sense for the health of the mother and the baby if the baby is born alive.
okay. All right. Thank you so much. Thank you, Madam Co-Chair.
Thank you, Senator Summers, to be followed by Rep. Gilchrist, to be followed by Representative Kennedy. Senator Summers.
Yes, thank you, Madam Chair. I just wanted to make a comment that, we've heard a lot tonight about the regs that were developed by DPH that were gonna go to regs review, but they never went. And there was some revised regs that just never went. They came here, which for many of us is kind of an issue also. But in that reg that was going to go, that didn't go, that was then pulled back, it stated abortions performed in the third trimester shall be done in a licensed hospital or ambulatory service. So I think that that is something that we need to continue to have in our statute, just for all the reasons that have just been said here today. Regardless of whether it's an emergency, there could be other issues where somebody has to be induced. Maybe the baby is not viable and they have to be induced, and that should be done in a hospital setting or an ambulatory surgical center. And that's what DPH had in their regs that never got to regs review. So I think that's important to recognize. And I understand that it's not legal in the state of Connecticut to have an elective abortion in the third trimester because of viability issues. But if there is one performed or someone needs one, and it doesn't necessarily have to be, quote, emergency, because you could have, as you said, I actually had a friend that this happened to who had a child that had this terrible form of dwarfism and was induced in the third trimester, and it was considered like a induced abortion. The child was not going to live anyway, but that needed to be done in a clinical setting. And I think it's just another added measure of safety to make sure that we keep that within our statutes so people are not confused and think that they can go someplace that they really shouldn't be going. God forbid there is an emergency or for other reasons. So I wanted to just put that out there. Thank you.
Thank you, Senator Summers. Rep. Gilchrist.
Thank you, Madam Chair. This is a question to the proponent of the amendment. Are you aware that state law speaks to what abortions can be performed prior to viability and after viability? Through you, Madam Chair.
Thank you, Representative Mara.
I'm sorry, can you repeat that question, please?
Representative Gilchrist.
Yes. Are you aware that current state law speaks to what types of abortion can be performed prior to viability and after viability? Through you, Madam Chair.
Thank you, Representative Mara.
I have not read through the types of abortions that are allowed. No.
Okay, thank you. Because to me, it seems that the amendment you're proposing is assuming that by repealing the regulations, we are somehow changing state law regarding abortion, pre-viability and post-viability, which is not the case. In section 19A-602 of state law,
Mhm.
we actually make clear that no abortion may be performed upon a patient after viability of the fetus, except when necessary to preserve the life or health of the patient. That will remain state law. And to the comment that was made earlier by the comment that was made earlier, we actually don't allow abortion post viability if the fetus is at risk. So maybe that was a friend from another state. And so if the life or health of the patient has to be preserved, that abortion is going to take place post viability in a hospital. Thank you, Madam Chair.
Thank you, Representative Gilchrist. Representative Mara.
Thank you. I appreciate that. And I've read through that. So when I said I hadn't read the details, I had definitely read that. I stated it out loud a couple times here. So I do get that part of it. And certainly when I was talking about the trisomy issues, so sometimes when there's issues with the baby, especially if the baby may be terminal, then that means that there's increased risk for the mother, because if the baby dies, of course, obviously in utero, then that's going to be a risk for the mother. So that was why I mentioned that. But yes, to preserve the life or health of the patient. So that's a mother. Yes, I get that. But my issue is, even when it's to preserve the life or health of the patient, meaning the mother, and there has to be an abortion that is induced to save the life of the mother, that should, it doesn't say in this line or any other line that I'm aware of that it has to be done in the hospital, because if for some reason, even if for a short amount of time, if there's an issue with an infant, that there should be health care for an infant that's born alive at that stage. And it doesn't, so it should be done in the hospital. I agree. And that's why I want to put it in statute to say that, because it doesn't say that here. It does make sense. I'm with you. It does make sense. And I think we all agree that it makes sense. But we just want to make sure that someone doesn't go to a clinic where there may, or somewhere else that doesn't have support in case that infant is alive, to make sure that there's support for an infant if it does survive. So that's that. Thank you.
Thank you, Representative Mara. Representative Kennedy. Oh. No, okay. Okay. I think, oh, I'm sorry, did I miss? Oh, Representative Jenga? Can you press your button, please? Press the microphone. Your microphone is, there you go.
Good. Thank you. Through you, question for the proponent. Under this amendment, what would be the penalty for somebody doing that?
Rep Mara.
What would be the penalty for someone that did?
Yeah, there's someone that violated this amendment, this law.
It's a very good question. So it's in regulations now. So I would say the penalties would be the same as the current regulations.
Okay, so there wouldn't be anything in addition under your amendment.
No, nothing additional under my amendment. No,
Okay, so there's no additional enforcement.
no.
Thank you.
Thank you. Representative Martinez.
Thank you, Madam Chair. I just want to point out that in an emergency situation where the mother's an emergent situation where her health is on the line, that care alone would not be done in a clinic. She would have to, for her safety would have to go to a hospital. That would be the level of care that that patient would need. A clinic would not be able to perform that level of care.
Thank
Can-
you, Representative,
Can I respond?
Representative Mara.
Thank you so much, Madam Chair. So then good, we agree, and I certainly hope that you support my amendment.
Thank you, Representative Mara. I think back to the very beginning of this conversation, the bill itself, which seeks to repeal the need for separate and additional regulations, and the perspective and opinion of myself and the proponents that these pieces of regulation, including this, are covered in many places in the statute, if not explicitly in language in this exact way, through a provider's license, through clinic licenses, and through scope of practice. And for that reason, I would ask my colleagues to vote against the amendment. If there is no other comments, Madam Administrator, would you kindly call the roll?
It'd actually be Mr. Clerk. Senator Anwar,
Senator Anwar says no.
Representative McCarthy Vahey,
Thank you, Mr. Clerk. Mr. Clerk, McCarthy Vahey votes no.
Rep. Belton, Senator Marks,
Marks votes no.
Senator McCrory.
McCrory votes yes.
Senator McCrory, I have to see your picture. I didn't see it.
McCrory votes yes.
Thank you. Senator Summers,
Yes.
Representative Clarice DiTrio,
Yes.
Representative Burger Javallo,
Burger Javallo, no.
Representative Biggins,
Biggins votes no.
Representative Carpino,
Carpino votes yes.
Representative Dauphiné,
Dauphiné votes yes.
Representative D'Amico,
D'Amico votes no.
Representative Elliott.
Elliott, no.
I didn't see. Can you do that one more time? Rep.
Or
Elliott?
can. Elliott, no.
Thank you. Representative Jenga,
No.
Representative Gilchrist,
No.
Senator Gordon, Senator Hockedal, Representative Cavros-DeGraw,
Cavros-DeGraw votes no.
Representative Kit,
Representative Kit votes no.
Representative Kennedy,
Kennedy votes yes.
Senator Kushner,
Senator Kushner votes no.
Representative Mara,
Mara votes yes.
Representative Martinez,
No.
Representative Morin-Bello,
Rep. Morin-Bello votes no.
Representative Parker, Representative Pauletta,
Yes.
Senator Rahman, Representative Reddington Hughes,
Yes.
Representative Ryan, Senator Slapp,
Senator Slapp votes no.
Representative Steinberg,
Votes no.
Representative Steinberg votes no.
Representative Zupkis,
Yes.
and then I'll go through the list again. Representative Belton, Senator Gordon, Senator Hockedal, Representative Parker,
Rep. Parker votes no.
Senator Rahman, Representative Ryan.
Votes no.
Thank you. Madam Chair,
Mr. Clerk,
20 total voting, 10 yay, 18 nay. Thank you.
thank you. The amendment fails. Is there further discussion on the bill before us? Senator Summers.
Yes, Madam Chair, I would like to amend the bill to add back in section B of 19-13 D54, which is the reporting requirements that are currently in statute. I move adoption of the amendment, and when the vote's taken, I ask that it be taken by roll. the reason that I'm doing this is because I think
Senator
it's-
Summers,
sorry.
before you go forward, if I can do a second from Rep. Claritas Teacher, and if I can ask you, if you don't mind just repeating your amendment.
Yes, it's to leave in the regs right now, we have deleted all the reporting requirements for performing abortions. And I am asking that we add those back in. I think those are important for DPH to track. That was not something that I saw deleted from the requirements of DPH that were supposed to go to regs review. And that's what I'm asking, that we put it back in, and I will read it quickly. It says that all induced abortions will be reported within 7 days by the physician performing the procedure to the state Commissioner of Public Health, who maintains such records in a confidential file and use them only for statistical purposes. Effective, sorry, I just lost my place here. Except in cases involving licensure. Such reports will specify the date of the abortion, the place where it was performed, the age of the woman and town, the state of residence, approximate duration of pregnancy, the method of abortion, and explanation of any complications. The name of the woman is not given. These records will be destroyed within 2 years after date of receipt, and in addition, a fetal death certificate shall be filed for each fetus born dead, which is the result of gestation of not less than 20 weeks, or a live birth certificate shall be filed for each fetus born alive, regardless of gestational age, as provided for Section 7-48 and 7-60 of the Connecticut General Statutes. If a live born fetus subsequently dies, a death certificate shall be filed as provided in Section 7-62B of the Connecticut General Statutes. So I'm asking that that be added to this particular bill, because I think it's very important, and I would like it to be effective upon passage, because there's no way for us to track what is happening if we don't include this tracking information. And again, this was not something that was deleted from Department of Public Health's original proposal or secondary proposal that was going to go to regs review.
Thank you, Senator Summers. I will note that the second portion of the amendment is covered in statute, which I believe we updated. I may be, I'm not positive I'm correct about this. I believe we updated this in 2023 related to the fetal death certificates specifically. Just a couple questions for the proponent, or my good ranking member. The reporting, what is your hope and desire in terms of the reporting? What information do you think it's important for us to be able to have with respect to this data?
Well, first of all, it's important to DPH because it's in the current regs and they did not remove it from the regs. So I think it's important that the Public Health Commissioner has these confidential files so we can look at where these abortions are performed, the age of the woman, maybe that we find, and we track this because I've asked for certain numbers, like I'm asked frequently how many abortions are performed for a particular age or under. And if you're not tracking it, we're not able to get that information. And surprisingly, it's very different than what people may think. So I think it's positive for her to track this information. It also can help us look at trends. If we see a spike in a certain age group or, a certain area, maybe we need more education or, access to birth control, et cetera, whatever it is. But without the data, we would not be able to collect that information and make any informed decisions. So this is something that, again, what is in our current regs was not requested to be taken out, but it is not included in this bill. And I do think it's very important, or else we'll have no idea. We have no reporting for physicians having to submit anything to the Department of Public Health. And this is only for statistical purposes. That's it. So I think this is very important to keep the standard practice that we have right now. Thank you, Madam Chair.
Thank you, Senator Summers. My understanding is that this applies only to outpatient clinics because these are the regulations for abortion clinics. So hospitals, are not required to report. Is that your understanding as well?
It does not say in this regulation that it specifically applies to outpatient clinics.
But the regulations themselves are the regulations for the clinics, not
That's
for
correct.
hospitals.
Mhm.
So I guess my point is that it's my understanding that we don't actually have complete and total information because we are not requiring the reporting from hospitals.
If you want to include that we have this report from hospitals, I'm fine with that also.
Thank you, Senator Summers. I believe that this goes back to the same general principle that I've been sharing today, which is the idea is to regulate and provide for the safety of abortion healthcare as we do for healthcare in our state, not to single it out and make a series of different recommendations. And we want to make sure that we continue to provide for safety, for the religious freedom. I certainly understand the proponents' desire to have that information, but I don't believe that it is necessary from a safety standpoint at this point. And I would urge my colleagues to vote against the amendment. Senator Summers.
Yes, so without any reporting, we have no idea in the state, regardless of whether something's done in the hospital. And as you heard many people speak here today, most of the abortions are done in clinics. They're not done in hospitals. We have no idea how many are done, what the age group is. We have no idea how many were born alive, if there's a death certificate required. We have no idea how far along you are in gestation. I think that's critical information for us to have. And again, this is in our current regs. I don't know why we would be stripping out those reporting requirements. It's for statistical purposes. So now when we have constituents ask us who may not be supportive of abortion, I am a pro-choice person, but I've had people ask me how many abortions are performed. I'm going to use this for people under 16 years old. And I'm able to respond to them and say, there's been X amount, which is much less than what people think it is. Now I will not be able to do that because there's no reporting mechanism at all. That's just one example. But I do think it's really important that we know where these are done. We have doctors that will provide information on where it's performed, the town, the duration of pregnancy, and fetal death certificates. And if a fetus is born alive, that a death certificate is issued. All those things that are currently in our regs that are just being stripped out, again, without this going to regs review. And this was not something that was deleted from the DPH original request to go to regs review, which it never went. So that's why I'm concerned about that. And I think that we should have a reporting mechanism. Thank you, Madam Chair.
Thank you, Senator Summers. Again, actually, I'm not sure I have the whole proper statutory reference, but we do have statute related to fetal death certificates. Is there further discussion on the item? Representative Clara DeStitria?
Madam Chair, I don't know if someone asked this already, but so if we delete this, there'll be no reporting any longer of anything in reference to abortions?
I am not definitively aware, but I believe that the deletion of or the removal of this regulation would remove the specific reporting requirement unique to abortion clinics, is my understanding. But I do have to confirm that.
Okay, that would be, we'd appreciate to get that information. I think it's important to continue report. We have the maternal mortality reporting, which is very important. And I don't know why all of a sudden we would just not want to get all this data to complications, age, races, where this is happening, and any complications that may happen in these abortions. So I thank you, Madam Chair.
Thank you, Representative. Representative Dauphiné to be followed by Senator Marks.
Chair, and in the public health arena, we are always looking at data, and not to reiterate what the good ranking member just said with regard to all the things she listed. We always look to that data. We just had an incident in Waterbury with the man that was locked up for decades, and there's no data with DCF with regard to that. We always like to look back at data. And I think this is a good amendment, and I encourage my colleagues to support it. Thank you.
Thank you, Representative. Senator Marks.
Thank you, Madam Chair. To the proponent of the amendment, if I may, Madam Chair.
Please proceed.
Thank you. So would you want all of the same kind of data for medication abortions?
Senator Summers.
Yes, this says what I'm looking for is what is currently in the regs, which says all induced abortions are reported within 7 days. They are collected for statistical purposes. It would specify the date of the abortion, where it's performed, the age of the woman, the approximate duration of pregnancy, the method of abortion. So yes, that would be required. An explanation of any complications. That's what we're doing now. That's what's in the regs now. This has been deleted. Again, this was not something that was deleted from the DPH proposed regs that never got there. And I don't see, with all the money that we spend in the state of Connecticut and the money that we give to nonprofits that support these services, why we can't collect this data and this information. This is currently what's happening now. And with that data, as we do in other cases, we look at trends, we look at clusters, we look at how we can improve the outcome of women's health, how we can prevent pregnancies from happening. Without this data, we have no idea. And that's all I'm asking, is to keep this in. They keep it for 2 years. They look at it for statistical reasons. Again, I said I'm a pro-choice person. I want to be able to support this, but I think that this has been done without these extra safety provisions. And this is something that I think is critically important. Thank you, Madam.
So what if my wait,
Senator Marks.
May, one more question. Thank you, Madam Chair. To the proponent. So I don't know if other medical procedures that are done in outpatient clinics, let's say cataracts or arthroscopies. I've had lots of eye surgery. Are all of those being tracked right now by DPH, where they all have to be reported? Because my question is, if they're not, then why are we carving out abortion?
Senator Summers.
Well, first of all, we're already doing this now, right? I don't know whether there is a reg. I can't speak to a reg. Maybe we can look it up to see if there is a reg on reporting for arthroscopy or for eye surgery. If there is, we should keep it in. There's a reason that we're tracking this data, right? And if we have a regulation in place here that we can collect data from, that could prevent us from continuing and paying for services or abortions that we may not have to, if we can provide education, if we can provide birth control in areas, whatever it is, but without the data, we can't do that. And this could be looked at as collecting data for preventative reasons. Maybe if there's a statute on eye surgery or arthroscopy or hip replacement that is needed to be reported, I say keep that in and DPH can look at it. So I don't consider, this an onerous requirement because we're already doing it. And without that information, we don't have any idea what's going on. We don't have any idea how we can prevent things. We don't have any idea how we can improve things, and specifically for complications. So if we don't have somebody who is reporting, complications, obviously, if there's complications within a termination, there can be serious consequences. And it can, in some cases, prevent a woman from having a child in the future if those complications are not treated appropriately. So I think it's very important that we continue to collect this data. Again, this is not something that was wiped out of the DPH regulations. And I understand there's two different philosophies here. Some of us just want to push it through with this bill. Other of us have grave concerns because of the way this is being done. And we're not asking to not do it. We're asking to have an added measure of safety, an added measure of reporting, an added measure of security for those that are actually doing the procedures. And it added a measure of comfort for us here in the state of Connecticut, rather than not going through the regs review process and doing this here. So that's all I'm asking, is to keep that reporting of the data that's being collected now, to continue that with that data collection. If at some point in time DPH comes to us and says, we don't need that anymore, we've got this figured out, fine. But that's not where we are now. Thank you.
Thank you, Madam Chair. I do oppose this bill. I don't have grave concerns about what's happening in the clinics that are performing abortions. Most abortions now are done via medication. And so I don't think this is necessary, and I will be voting no. Thank you.
Thank you, Senator Marks. We did hear in testimony that there was a sense that the reporting was a bit onerous, but again, that's the perspective of the providers who are providing these services. We've heard from folks at times in terms of that. So apologies, I'm getting a little tired. Representative Zupkis, I believe you're next.
Thank you, Madam Chair. You know, every committee I sit on, it's always about data. There is no decision made without data. Everybody wants data. Everybody thinks it's too much to give data, but everything in this building is data, data, data. And I completely support this. Data for good things too. I mean, data is information that can be used in a positive way. It's information to help us improve on things. Data is what we all talk about, look at, and really how almost every decision in this building is made on data. And so I strongly support this. If we don't have data on healthcare, I don't know of any other place in healthcare that is not data driven. So I encourage everyone to vote for this because, again, data is a good thing, and it can be to make things better, improve on, or to rave about the good things that you do. Thank you, Madam Chair.
Thank you, Representative. Oh, Senator, nope. Senator McCrory was there. Senator Anwar to be followed. Nope, actually, I'm going to go back. I'll go to Senator Anwar, then Senator McCrory, then Rep. Dauphine.
Thank you, Madam Chair. I just wanted to ask a question of the proponent of the amendment. So Senator Summers, tell me, how are we going to protect the protected health information or private personal health information of the individuals in this?
How do we do it now? It's being done. So it's private. It says right in there, it's a confidential file. It's currently being done. So if you're saying that we're not protecting
No, I'm not. I'm asking you a question.
the same way we do it now.
So, but you said about the data collection. So help me understand the data collection part, because the data is now going to go to Department of Public Health and go through Connie. Is that?
No, that's not what I'm saying. I'm reading this directly. All induced abortions will be reported within 7 days by a physician performing the procedure to the State Commissioner of Public Health, who will maintain such reports in a confidential file and use them only for statistical purposes. That is what we're doing now. So we will just continue to do that. So if you're implying that it's not confidential, then currently what we're doing is not confidential.
So the data that is collecting, does this have the person's identification, the name, date of birth, and that kind of information as well?
It has the age and the town of residence. It does not have the patient's name.
So they cannot be identified based on their name and details or addresses or anything like that?
That is correct.
And you're saying that the Department of Public Health is already collecting this data?
Yes, that's in our current regs right now.
Or is it what they were hoping to get in the regs?
This is the current reg.
Okay, all right. just wanted to clarify. Thank you so much, because I recognize that people have serious concerns about their confidentiality, and that's part of the reason we don't want to create barriers. There are so many barriers around this care, so that's why I wanted to ask that question. Thank you, Madam Co-Chair.
Thank you. Senator McCrory, you had your hand up.
Yeah, I think I'm kind of getting my answer. My question would be, why wouldn't we want to collect data?
Can you repeat the question, Senator
I guess
McCrory?
my question is, if we're currently collecting data, why wouldn't we want to continue to collect data?
And
If
that's
we're already currently doing it, why would we not want to continue to collect data? And we learn a lot from data, like some of the comments I heard earlier, trends, data, demographics, all those great things. How come we wouldn't want data?
Is that to the proponent of the bill, of the amendment?
Well, I'm assuming that, yes.
Making a comment.
Yeah. No, well, I'm asking, to the proponent, why? I guess they can explain easily. Why would we, to the proponent of the amendment, why would we not want to continue to collect data?
Senator Summers.
Yes, through you, Madam Chair. I have no idea why we would not want to continue with that. So I appreciate that perspective. I agree with you that we can, from the statistical data, again, this is de-identified data, we can identify trends, we can identify, maybe we have a pocket in a certain demographic or a certain age group that we're seeing a spike in the rate of abortions at a certain time frame. Maybe we can intervene, maybe we can do more education through our community healthcare workers. We could setting up more informational, I don't know, it's late, but there is a lot that you can learn.
Yeah.
Trends, et cetera. We could look at, maybe it's a certain populations that we're seeing a higher spike in like young pregnancies that we could intervene, and then therefore we could prevent a woman from having to make the decision that she may have to make if otherwise not informed. I just think data is a really strong tool for us to use, and we're doing this now. So why would we want to stop it unless we just want to put blinders on and not see what's happening and disregard what's actually happening there? This can help us make some really good policy decisions moving forward. And I think it's short-sighted to just delete this from the regs when we're doing it currently. So thank you for your comments.
Okay, I guess.
Senator McCrory.
Thank you. Yep, thank you.
Thank you, Senator. Representative Dauphiné.
Thank you, Madam Chair. I just wanted to comment, we give millions of dollars to Planned Parenthood, the taxpayers' money. There's absolutely no reason why we can't collect the data that I think the good ranking member just mentioned several reasons why, what we gain, the knowledge we gain, who's benefiting from the resources that they're being provided, who's not benefiting, the age, the race, all of those things, were there complications? All those things are so important, and we learned so much from them. And I think it's the least we can do to provide the taxpayers for the thousands, if not millions of dollars that we give to Planned Parenthood to provide these services. I highly encourage our colleagues to support this amendment. Thank you.
Thank you, Representative. Representative D'Amico, to be followed by Rep. Reddington Hughes.
Yep. Thank you, Madam Chair. Just had a quick question for the proponent of the amendment. Just wondering if, to her knowledge, besides abortion, does Connecticut state statute currently require data collection for any other types of medical procedures?
I can't answer that fully, but I can tell you that we do collect data as it states here for complications and adverse events from hospitals. We do collect that data. So if you have a hip replacement and something bad happens, the hospital has to do an adverse event, and those are reported. And this does speak to that with an explanation of complications. So I'm just going to throw something out there. Let's just use this as an example. Let's say that somebody is prescribed the abortion pill. They go home, they take it, and there's a complication, heavy bleeding, hemorrhaging, that would be reported here. If not, we have no idea that that has happened. And then from that, we cannot look at the trends that may occur. This is not asking for anything new that is not already being done. I'm not sure why we are so ready to delete that information when DPH has it. They only have it for 2 years, and they can give a report to us. We can ask them for the information. We could have a spike, let's say, in young females that live in Mystic, Connecticut, becoming pregnant at an early age and seeking abortion services. We could certainly look at that data and then say, maybe we need to put a full court press in that area to do more education, to make sure that they know that there's birth control that's available, blah, 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 blah. But without the data that's collected, we can't make those decisions. And that's why I think it's so important. Thank you.
Thank you, Representative
If I
D'Amico.
may, thank you, Madam Chair, and I thank you for the explanation. But what I was trying to get at, and I appreciate the fact that, as you mentioned, that data collection is required for adverse situations. But to go back to my original question, is data collection required other than adverse circumstances? Is it required for other types of medical procedures besides abortion?
The only thing I can say is that we have this Connie system that collects every single procedure, you have to either learn to opt out, which is not easy. So if you go and have a facelift right now, that is recorded and it's put in our data collection system, our Connie system. So in some respect, we're collecting data on every single procedure.
If I may, Madam Chair, but is that currently required in state statute?
That is a law that we have that whether you like it or not, it's really hard to opt out. But yes, it's being collected as we speak. I think we have carve out for behavioral health and mental health services.
Thank you. Thank you, Madam Chair.
Thank you, Rep. D'Amico. We have some other legislation about that topic, actually. I know Senator Anwar has a couple questions, but I would just like to ask first, and this is a genuine question I don't know the answer to, and perhaps you do, Senator Summers. What is done with the data currently? How are we currently using the data that is collected?
Which data are you talking about?
The data that's being collected in these regulations from the outpatient clinics, but not the hospitals.
I honestly cannot answer that. I think DPH would have to answer that. I know right now if I request information from DPH, like I said before, I've been asked by people that are not supportive of a woman's right to choose. That they want to know how many abortions, let's say, were done under the age of 16. And I'm able to get that information from DPH because they are collecting the data. And, I'm sure that if we ask them to compilate the data and give us a report, they certainly would be able to do that. But they're not going to be able to do that if we're not collecting the data. And I should say on the Connie system, I think that these services, abortion services, are also carved out of the Connie system. So the Connie system is tracking every hip replacement, everything you want to do. We have bills in there right now. There's people that don't want their information for women that are going for plastic surgery. They don't want that part of their data because they don't want to tell anybody they had a facelift or whatever is part of the Connie system. It's not easy to opt out. And you don't have a choice when you go to an OBGYN or a heart doctor to opt out of individual procedures. So we're collecting all that data. I do believe, unless I'm wrong, that abortion services are carved out of that Connie system. So they're not being reported through there. So this is just another data collection. It's only kept for 2 years. And we can really, if we wanted to drill down, get some useful information out of the data that is collected. Again, this is not asking anybody to do anything above and beyond what is done now.
Thank you for that. And one more question, and then Senator Anwar, on to you. I think one of the things we haven't really talked about here today is that, well, we've talked about the fact that we all have very different views on the topic of abortion, and that those are personal views that come from a lot of reasons. And there are people in the state who would like to make sure that we have free and full access to abortion health care, and there are others who would like to restrict access to abortion health care and limit that care. So would you agree that some of the use of that data is, in some cases, by people who would like to restrict that access to abortion health care?
I don't think that the people that are not necessarily pro-choice wrote this regulation. I don't think that they had any say in this regulation, so I'm not really sure that I would agree with that assessment.
That's a fair answer. Thank you. Senator Almar.
Thank you so much. Thank you, Madam Co-Chair. I wanted to ask from the proponent of this amendment, and this is a serious and sincere question. Are there DPH regulations on vasectomies?
I haven't really investigated vasectomies lately. I can't say that. I don't know if they, is there data on sterilization? I have no idea. All I know is that this is currently in statute. I think it provides us an opportunity, like I have repeatedly said, to look at trends if we chose to see if there are a rise in certain areas where we can help prevent an unwanted pregnancy versus having somebody.
So, no, you don't know, basically.
I don't know.
Okay. And the reason I say that.
Other than the Connie system, which would track
Right,
if you're having
but
a
we're not talking
vasectomy.
about Connie because.
But that's a data tracking system.
Right. So again, Connie would not get the abortion data. The reason is that there's a reason Connie will not get the abortion data because Connie is not secure. That's part of the reason we are having bills around that. So why are the women's reproductive rights being treated differently in the state? Why is just we want to have special regulation for the women's reproductive aspects and not for the men's reproductive component? I'm just wanted to clarify from your perspective.
If you would like to add vasectomies to this, I would be happy to do that. If you want to add the requirement to report abortions through the Connie system, we can do that. But this is a way to have the information reported in a confidential way that we can look at as the Public Health Committee or DPH to identify trends, this and that. This is not trying to stop abortions. This is not trying to infringe on anybody's right to choose. This is not doing any of that. This is just continuing what we are currently doing. But if you would prefer that it go in the Connie system, that would be a way to track it also. If you want to add reproductive vasectomies to this, I'm fine with that too.
I'm more interested in not having either one. So that's where I'm at. But thank you so much, Madam Chair. Back to you.
Thank you very much. Representative D'Amico.
Thank you, Madam Chair. And not to belabor this, but I would like to align my remarks with the most recent remarks of your co-chair. I'm really troubled by this. I don't know what else to call it, abortion exceptionalism. If it's currently being tracked and nothing else is required under state statute, I'm questioning why that even needs to be done. And I would agree with the sentiment that was just expressed. Perhaps we should do away with this rather than extend it, as has been suggested, to other areas. Perhaps we should remove it and not make it mandatory. But I guess that's another bill for another day, Madam Chair. I'm concerned about this abortion exceptionalism that seems to be cropping up quite a bit here tonight. Thank you.
Thank you, Representative D'Amico. I think there's a fundamental discussion today, which is, do we continue to regulate either slightly differently or similarly to how we currently regulate abortion? Or do we, as a state, want to regulate abortion in line with other healthcare? And that's the heart of the discussion that we're having here today. I think that is a big part of the discussion. I believe Rep. Mara and Rep. Reddington Hughes. I don't know which of you was first, so I'll let you two decide. Representative Mara?
Thank you very much, Madam Chair. I wouldn't call this exceptionalism. We talked earlier today about fatty liver disease, and we know the percentage of fatty liver disease because we collect information. We talked about opioid. We talk about opioid deaths. We collect information about opioid deaths. And we talk about COVID and we talk about flu. We collect data about that. We collect data across the board because as a public health committee, it really helps us see where the health of our residents are. And we do know, I mean, this is, maybe this is obvious to some people and maybe not to others, but when we look at risky behavior with people with pregnancies, we know it's safer for a young woman to not be pregnant, right? These are safety things when we look at public health. We know that it's when they come in with STDs, we know that there's safety issues around that. So this is data, and that's not necessarily on this particular thing, but these are things that we collect because we care about our residents and we're looking at ways to better help them. So if this is or is more onerous than it should be, then I think that's something we should talk about. We don't want anything to be onerous for our providers, but and I know I don't actually mention that I worked in healthcare as well very much, but I'm going to do it this one time, and let you know that if you don't document your procedures, if you don't document what you did, you didn't do it. And as a healthcare worker, we know that. So everybody is documenting and they're doing what they're supposed to do. I don't think anybody here is trying to put something out there that we think is going to be harmful. We're trying to look at the health of the state of Connecticut. And I think this is a really good way to do it. We collect data. We look at the health of people. So thank you for letting me make my comment. I appreciate it.
Thank you. Of course, Representative Mara. Representative Reddington Hughes.
Thank you. And to the proponent of the bill, of the amendment, I'm sorry. I just wanted to let you know that I really thoroughly agree with this because we do, as other representatives have stated this evening, okay, we do keep records of other things as well. I mean, there are tumor registries, there are other things that have been in place for many, many, many years. So this is not something that would be discriminating only for this particular item. And I think that part of the problem here is that we're not really looking at the end goal of what was really, well, what I think people wanted to realize when this was put together, which was the access to care. So without this data, I really don't see how we would ever be able to get the correct numbers to see if there were pockets where there was needed access to care and be able to serve those populations better. So I would ask you to support this for many, many reasons. Thank you.
Thank you, Representative Reddington Hughes. We have Senator Marks to be followed by Representative Clara DeStitria to be followed by Rep. D'Amico. Senator Marks.
Thank you, Madam Chair, for the second time. I apologize. I just had to say to Rep. Mara, when any adverse reaction to any medication is going to be reported. Any infection that anybody gets, whether it's a STD, whether it's norovirus, whether it's H flu, all of those have to be reported. There are certain things that have to be reported to DPH. But when Planned Parenthood does coloscopies, which is if you have HPV, they don't have to report those to DPH, right? And so again, I liked the abortion exceptionalism. So once again, it is just we're making abortion, which is a medical procedure, that has to get reported to DPH. I can guarantee you that Planned Parenthood or whatever outpatient clinic is performing abortions, they are going to keep data, right? Like everybody said, we all love data. Everything is in their computer, and you can go onto Planned Parenthood website and you can see the trends, you can see what's happening. All of this is about reporting to DPH, and there is no reason why any institution that performs abortions should have to report to DPH unless there is an adverse reaction. And that happens in anything, in any part of healthcare. So, once again, I do not support this amendment. And Madam Chair, thank you so much for indulging me and letting me speak again.
Thank you, Senator Marks. I'm losing track. I'm going to go to Rep. Clara DeStitria and then Rep. D'Amico for the second time.
Thank you, Madam Chair. Just a comment. We were talking a lot about collecting data and why we're collecting data. Well, there are a few reasons. We collect it to improve, we hear all the time, to improve outcomes, to control cost, to promote access to healthcare, to promote high quality access to healthcare programs. And then we analyze all of it, and also to identify and address constantly health disparities in different parts of the state, in different populations. We do this all the time in different areas. So why should this be any different? We want to see what trends are happening. If there are more young kids, young girls having abortions, why? Do we need to put more money into that area to make sure they have options, to know that they have access to reproductive health care, they have access to contraceptives? We do it all the time and everything else. So why are we going to stop doing it for abortions? It's important. It's healthcare and it's access. So I encourage everybody to vote for this amendment. Thank you, Madam Chair.
Thank you, Representative D'Amico for the second time.
Thank you for your indulgence, Madam Chair. I would feel much better about the argument that's being advanced with regards to data collection on abortions if, in fact, it were in state statute that data had to be collected for other medical procedures other than ones with adverse outcomes. However, what I have garnered from the discussion for the last several minutes is that, in fact, this data collection is not required for other medical procedures other than abortion. So there seems to be a big inconsistency here, and I'll say it again. I am troubled by the fact that we are hung up on abortion exceptionalism, and until somebody can show me otherwise, I'm going to stick to that position. Thank you, Madam Chair.
Thank you, Representative D'Amico. I think that we have established that there are other aspects of healthcare that we do collect data on. Perhaps that is done in a different way. This is currently the way this data has been collected to date has been through the regulation. But I will go back to the proponent of the bill if you wanted to.
I didn't hear
respond.
anything you just said. I'm sorry.
That's okay.
I was tuning out,
I-
but
Senator
to
Summers.
Representative D'Amico through Madam Chair, I did say that we are collecting data on other procedures. It goes through our Connie system. Our Connie system collects data on every procedure. And the only one that is carved out is, I believe, abortion services. That's not part. So if we want to treat abortion services like every other procedure, it should be part of the Connie system. There's hesitation because Connie's, I just heard today, is not confidential. If for anybody who's in the system, your stuff is not confidential anymore. But if we want to treat it like anything else, then it should go through the Connie system. They specifically took it out, I believe, and I don't want to misspeak, because this was a way to keep it confidential in DPH, and it is only held for 2 years, where the Connie system, I think, is held for 7, maybe longer. So, you know, I heard other people say we should treat it like every other procedure. That's fine. Then put it through the Connie system. If you want to track everything, go ahead. But we shouldn't not track this, because then we can't look at trends, as you've heard repeatedly. I don't want to repeat what I've said and what Representative Clara DeStitria has, but there's a lot of good data that can come out of that to help either prevent unwanted pregnancies, to provide access in certain areas. And we have to keep in mind, if we can also prevent a pregnancy, we prevent a probably very difficult and unwanted circumstance for a young person or a not so young person. And, you know, we're also paying for those services. So if we can prevent those, we can provide access, reduce healthcare costs. And if we want to have this be equal to everything else, then it should go through the Connie system. But we don't want to do that. And then we don't want to collect it. And I'm not sure why there's such apprehension to collecting data when we collect it on every other procedure. That's all. Thank you.
Thank you, Senator Summers. And you're making some good arguments as to having minors access to contraception. I'm giving you a hard time and teasing you on that. We have Representative Kavros DeGraw to be followed by Rep. Berger Jaballo to be followed by Rep. Gilchrist. Representative Kavros DeGraw.
Thank you, Madam Chair. I think part of the conversation that I have not heard tonight is the larger context in which we are having this conversation. I understand the need for us to have data on certain procedures. I understand that people may want to be able to see trends. The challenge with this topic, which both speaks to the exceptionalism and to the fact that it is a difficult conversation, is that in the larger context of the wider world of not just Connecticut, but the country, there are people who are accessing people's private data. There are people who are doing, we don't know what with that data. Even the company 23andMe is going bankrupt and people are freaking out and trying to figure out how to delete their data. So while there is a larger conversation about data, you know, for some women, the day they have to have an abortion can be one of the worst days of their life for a variety of reasons. For some women, it's a freeing day. And I think that, you know, trying to find trends is almost more judgment being placed on the procedure. So I think that as we are talking about this, we have to think about the wider context of how data can be manipulated, about how data thefts happen. And I certainly think, considering all we have done to protect privacy in the state of Connecticut around this topic, I don't want to see us go backwards. And I think that that's part of what this does. And so I do hope that my colleagues will be voting no as well.
Thank you, Representative Kavros DeGraw. Rep. Berger Jaballo to be followed by Rep. Gilchrist.
Thank you, Madam Chair. And really just kind of tapping into what Rep. Kavros DeGraw just said and taking it just a step further, given statements made by multiple members of the current presidential administration, as well as a memo that came from Secretary of Transportation Duffy, we are looking at a very different world than we were when we were talking about reproductive care in any previous sessions. We can't pretend that this is the same. We are talking about elected officials who have very clearly stated that they want to monitor pregnancy, they want to monitor women's health care, they want to monitor birth rate. And I think that this becomes a very different conversation. And I just think it's important to remember this isn't the same world we were having these conversations in last session before. That's all. Thank you so much. Appreciate the indulgence late in the night.
Thank you, Representative Berger Jaballo. Representative Gilchrist.
Thank you, Madam Chair. And to the proponent of the amendment, and it is late, so my apologies. Can you speak to, again, what you mentioned of why it would be important to collect data? What could be done with the data?
You know, I think I've repeated myself plenty of times on this. And, you know, if you don't agree with collecting the data, that's fine. I agree with collecting the data. We have heard repeatedly from here that we need to treat abortion like every other procedure. Then it should be part of the Connie system. But this particular is carved out. So Connecticut collects healthcare data to improve health outcomes, control costs, promote equitable access to high quality healthcare, and it's based on data analysis. Instead of calling it abortion exceptionalism, maybe we should have extraordinary data that we can make sure that we're making the correct policy decisions that help all women in the state of Connecticut. Again, this is de-identified data. We could look at trends. We have repeatedly, many of us had repeatedly says, if we get the information from DPH and we find, let's say that certain women of a certain age and a certain demographic, we're seeing a high spike in abortion. We have an opportunity there to do education, to provide birth control, to work with our community healthcare workers to make sure people know they have access to prenatal care if that's the way they want to go, or to make sure that they know that there is a choice for abortion services, et cetera. But without the data, we don't have any of that information. We don't know at what stage abortions are being performed. So we could put more emphasis on, you know, early detection, et cetera. We don't have any of that. And what do we say to the people of Connecticut when we are collecting data on every single other procedure through our Connie system, which is not easy to opt out of? When somebody says, well, what are the trends in X, Y, and Z? How do we respond to that if that data is not being reported to the state of Connecticut? We don't. We say, we don't know because we don't collect data. We don't know how many of these are done, who's getting them done, where they're getting them done, what the trends are. We don't know because we don't collect the data. We've decided to not collect the data. But every other procedure, we are collecting data. So we either are in or we're not in. We are either going to collect the data and treat this like every other procedure. Great. Or we are going to protect it and make sure it's confidential, because there's questions I just heard tonight that Connie is not confidential, which is exactly what's happening currently. It's held for 2 years in a confidential file. Nobody's using it for any nefarious reasons other than looking at trends and where we go from here. And remember, the state of Connecticut is paying a lot of money for these services. I would rather have them be able to do preventative, so that we don't put a woman in a position where she has to make a choice that may not be a pleasant one, to say the least, for her and her family or her friends or her decision. So that's all this is for. I don't understand the hesitation to this. I don't understand why we wouldn't continue doing what we're currently doing. That is causing no harm. It just gives us information when we get information on every other procedure. So that's my opinion. Clearly, I understand that most of you will not agree with me, but I think it's important to address this. Thank you.
Thank you, Madam
Thank
Chair.
you.
And how long have we collected the data currently?
I can only say that it's in the current regs. I don't know how long that's been.
Do you know if the data that's been collected since the regs have been in place has been used to
I know I've
control
used it.
costs and improve health? I know you did mention using it to tell constituents how many abortions are performed, but has it been used in the manner you've spoken to tonight about improving health outcomes and controlling costs? Through you, Madam Chair.
Thank you, Representative Gilchrist.
I know that we have asked through you, Madam Chair, in the past, not this year, but in the past, maybe I've been on public health for, this is going to be my 9th year. So in the past, we've asked to look at the data and the trends, how many people are having them at this age, how many are done in the first trimester, the second trimester. I know that we have asked that for that information from DPH, and I have gotten that before. Thank you.
Thank you, Senator Summers.
But to the best of your knowledge, it hasn't been used in any concerted effort to make policy change. Through you, Madam Chair.
Thank you, Senator Summers.
Actually, through some of that data, many of us, I know myself and Representative Clara Destitria, we had put in bills to make sure that Plan B was available by a vending machine in colleges, that we made birth control more accessible through our pharmacists, et cetera. So that data had a lot to do with the bills that we and the policies that we did submit. So I would argue that, yes, it has been used in policy decisions when we submitted bills.
Thank you, Senator Summers. Rep. Gilchrist.
Thank you, Madam Chair. So you're contending that the decision to offer emergency contraception on college campuses via a vending machine was based on abortion data from the state of Connecticut? Through you, Madam Chair.
Thank you, Representative Gilchrist. Senator Summers.
I'm saying it was part of a tool in a toolbox that made us be aware of what was happening and to try to provide access to care when something happened for Plan B that would help you prevent having an unwanted pregnancy. And that was part of the reason to submit bills that we have. Yes.
Thank you, Senator Summers. Rep. Gilchrist.
Through you, Madam Chair, does the abortion data that's currently reported to the Department of Public Health break down if the individual accessing abortion care is a college student or not? Through you, Madam Chair.
Thank you, Rep. Gilchrist. Senator Summers.
No, but it talks about the age of the woman.
Thank you, Senator Summers. Rep. Gilchrist.
It also says where it's being performed. Sorry.
Rep. Gilchrist.
Thank you, Madam Chair. I am guessing, based on our conversation of when the regulations were implemented back in 1991, and it took about 5 years. So if we've been collecting data since 1996 here in the state of Connecticut, and the answers I got are the answers I just got, I don't see the need to continue to have the state collect this data when we know that the providers performing abortion in the state would collect it themselves. I agree with the statement on exceptionalism and would ask my colleagues to oppose this amendment. Thank you.
Thank you. We have Representative Mara to be followed by Representative Martinez to be followed by Senator Gordon.
Thank you so much, Madam Chair. In some ways, I believe the exceptionalism may be the other way with abortion services, since it's actually carved out of the Connie program. But I had heard some of my colleagues ask where in statute reporting is required. And I'm sure it is in several places, but certainly it is in 19A 634. And it's for utilization studies that that data can be collected, including procedures performed, scan performed, calendar year, total number of clients, treatments, patient visits. So that allows data to be collected.
Thank you, Representative Mara. Representative Martinez to be followed by Senator Gordon.
Thank you, Madam Chair. I just wanted to point out that the Connie system isn't a database to collect data for the purpose of looking at trends. It's to share patient information so that, you know, if a patient goes to, say, a Yale hospital versus a Hartford Healthcare Hospital, they, you know, the information could be shared easier. And I do want to say that although it's not confidential, I would presume is just meaning that, yes, there is a patient's name in that information, but it's not like public in any type of way. And it is actually one of the easiest systems to opt out of, because what's nice with the Connie system is that it goes per person. So when you opt out, you are out of the Connie system. So you're not going to each specialty type of provider. You don't have to opt out from each doctor. You're opting out of the system on their website. Thank you, Madam Chair.
Thank you, Representative. Your point is well taken in terms of the way Connie works. I think part of the question about the data conversation is who gets to own the data, how and why. And I think, you know, part of the hope of using Connie is to be able to look at some of those trends. But to your point, it's differently available kind of data. I have to look at my list because I am losing track. Oh, Senator Summers as the proponent, and then Senator Gordon.
I will say that the Connie system was set up so we can look at trends. And you mentioned that it's confidential. Well, the requirement to report here is also kept in a confidential file. Sorry.
Thank you. I will note before going on to Senator Gordon, I just want to say, I know people have expressed concerns tonight about Connie. Connie is like any other data system that we have that is a confidential data system. It is just like our credit card data, our bank data, our records. We've seen this in our state. We know that those issues around cybersecurity are an issue for lots of people, but generally speaking, that is a secure data source. The reason that people become concerned about the data in Connie and the sharing of abortion data, to Senator Summers' point earlier about certain types of services, that in cases, in places, other places in the country, thankfully not here, that data and that those receiving abortion care, there's concern that be shared. So that data question and concern is out there for many people who are receiving abortion care. And Senator Gordon, you have been waiting patiently. Please proceed, sir.
Thank you, Madam Chair, and I've been listening to what's been discussed. And I'm going to look at this from a public health point of view, not from a political or anything else point of view. And I think what Senator Summers has been getting at is also from the same point of view, the public health point of view. There's tons of things in the healthcare field that get reported, not just things that the typical mandated communicable diseases, for example. There are many things that I as a doctor have to report on and that hospitals have to report on. And that's just not at a state level, but there's also federal collection data that the states feed into the CDC depending upon what the CDC might want at any particular time for these analyses. And things do get published and do get put out there for review for statistical and analytic purposes. Hence why the CDC publishes almost weekly data on a whole bunch of different things to keep people informed and to have analytics. This is no different, and I'm not looking to do anything that's going to be limiting people accessing what is legally in this state medical health care. But we need to take a step back when we have people start talking about all sorts of intents and medical exceptionalism one way or the other and all that type of stuff, is that the state does collect data. It has, if you request the data, which you can do actually going online from DPH, get an annual statistical summary. It is patient de-identified data, like many things are, if you want to look at what goes on with number of people who have heart attacks, number of people who undergo hip replacements. There's all sorts of data sets that are out there. This is just one of those, and it can be used to see what might be happening in different parts of the state, different demographic groups, different socioeconomic groups, to get an idea of what's happening from a public health point of view. And I think if we take a step back and look at all of healthcare, we do many times do this in order to really understand not the politics of it, but the public health aspects of it, to be more informed and to be making decisions that could potentially in a good way improve healthcare for people wherever they may be in the state of Connecticut. I know the federal government does this as well. A day doesn't go by I don't read some type of CDC report one way or the other of information that can be helpful or that comes to me, usually by electronic forms nowadays and not printed forms. So I think if we take a step back and look that the state does collect patient de-identified data, we know that the clinics that do perform procedures relative to pregnancies certainly have to keep records anyway, and these records are kept confidential as they are at hospital systems, that we could take a look and realize that there is no particular carve out or putting something in for one particular reason. This is just part of the overall public health that's done, and that the Department of Public Health does collect this data and it is available upon request. And just a quick comment relative to Connie, I'm not shocked to hear that Connie might not be secure. I've raised concerns for a year about Connie and think that we don't need to be spending our taxpayer money on it when we have a completely good and very secure CT Health link that is connected to multiple states and proven to be secure. So I just want to put a plug in again that we really don't need Connie when we have some much better systems that don't drain taxpayer money. Thank you, Madam Chair.
Thank you, Senator Gordon. Seeing and hearing no other comments on the amendment. Mr. Clerk, is this you? Wonderful. Mr. Clerk, we're thankful for you and for Madam Administrator both, and the whole team who's sticking with us tonight. Would you kindly call the roll?
Senator Anwar,
This is voting on the amendment as a no. Senator Anwar votes no.
Representative McCarthy-Vahey,
McCarthy Vahey votes no.
Representative Belton, Senator Marks,
No.
Senator McCrory,
Yes.
Senator Summers,
Yes.
Representative Claire DeStitria,
Yes.
Representative Berger Javallo,
No.
Representative Biggins,
Biggins votes no.
Representative Carpino.
Carpino votes yes.
Thank you. Representative Dauphiné,
Dauphiné votes yes.
Representative D'Amico,
D'Amico votes no.
Representative Elliott,
Elliott, no.
Representative Jenga,
No.
Representative Gilchrist,
No.
Senator Gordon,
Yes.
Senator Hockedal, Representative Cavros DeGraw,
Stavros DeGraw, no.
Representative Kit,
Representative Kitson.
Representative Kennedy,
Kennedy votes yes.
Senator Kushner, Representative Mara,
Mara votes yes.
Representative Martinez,
Representative Martinez votes no.
Representative Moran Bello,
No.
Representative Parker,
Parker votes no.
Representative Paletta.
Paletta, yes.
I didn't see your face, Representative Paletta. Can you do that one more time? Sorry.
Paletta votes yes.
Thank you. Senator Rahman, Representative Reddington Hughes,
Yes.
Representative Ryan,
Representative Ryan votes no.
Senator Slapp, Representative Steinberg,
Representative Steinberg votes no.
Representative Zupkis,
Yes.
Madam Chair.
Mr. Clerk?
27 total voting, 11 yay, 16 nay. Thank you.
Thank you, Mr. Clerk. The amendment fails. Is there further discussion on the bill before us? Senator Summers.
Yes, we're going into that magic hour right now. So I had a few comments on the process here that we have used to get to where we are. So, oops, 1 second. I'm sorry. I have to pull up my reference really quick. Whoops,
Sure.
wrong thing. Sorry, apologize. So typically, when we're deleting regs, they go to regs review. I sit on regs review. I know Christine Carpino, who is co-chair, also has reiterated this. So, but we haven't done that. And there was regs that were submitted to DPH and then they were pulled back and then they were going to go again, but they never went. So here we are in public health, deleting regs that are, currently in place. But when I look at the Uniform Administrative Procedure Act 4-170, it says in section B, no adoption, amendment, or repeal of any regulation shall be effective until a variety of things happen. An electronic copy of the proposed regulation is approved by the Attorney General, provided in this section. It goes all through all these different things that have to be done in order to delete a regulation. It goes through how the committee receives it, the first Tuesday of the month, on and on and on. Each proposed regulation, whether it's deleted or amended, shall have a statement of purpose following the final section of the regulation. The committee may permit any proposed regulation by reference that incorporates in whole or part other code, rule, regulation. It goes on and on and on. So that is the way we are supposed to follow the procedure to remove a regulation. But in fact, we are not following our current statute, and we are averting that and going this way, which does not comply with our current law. So I am offering an amendment to the bill to strike sections 2 through 4 in their entirety and number the lines in the sections accordingly. I'd like to move adoption of this amendment, and when the vote is taken, I request that it be taken by roll. What this does is strip all the changes to the regs that really should go through regs review the correct way out of the bill, and it would then require this to go through the proper channels and follow state statute and go through regs review, which I sit on, which is the body that has the cognizance over regs review, not public health. So that is the amendment, Madam Chair. So.
Thank you, Senator Summers. The amendment has been made by Senator Summers and seconded by Representative Clara DeStitria. The amendment is to strike sections 2 through 4 of the bill. And I will begin. There is precedent for regulations to be repealed in statute, and the legislature's process for repeal of legislation is regulations, is different than that which is required by agency. As I said here earlier today, and I see the good representative who also serves on regs review here with her hand up. There are different policy decisions. One is to maintain regulations which would then, if that is the decision of the legislature, it would then need to properly go through the regs review process as was described. It would need to go before the committee and be acted upon and approved by the regs review committee. On the other hand, if the legislature decides that we would like to repeal these regulations in their entirety and rely on the regulations that do continue to regulate and provide for safety and that abortion care as health care, that is a proper decision and is something that we are able to do. I think they're policy decisions. I certainly understand the concern about the process because I do believe we want to try and stay within the cognizance of our different committees. But from here in public health, we are able to repeal those regulations in statute properly, and there is precedent. Senator Summers.
Yes, thank you, Madam Chair. I find it interesting that these were going to go through regs review. So the intent was originally send it to regs review the proper way, which would be repealing some of this stuff, but then it was pulled back and now we're going this way. To me, that is subverting the process. And it specifically says right here, whether there's precedent or not in section B, no adoption, amendment, or repeal of any regulation shall be effective until a laundry list of things, you can look it up, I can show it to you, are completed. So, it would have been one thing if this started in public health and it was never sent to regs review and then pulled back. And I hate to do this because I understand, I wanted to support this bill. I felt like it made sense to repeal these, but it to be done the proper way through regs review. I felt that it was necessary to make sure that we had that one line that said, that referred to your religious rights left in there. But now we have subverted the regs review process, whether there's precedent or not. And we have not included the things that we think, many of us think are really important. And, this is one thing that it didn't just start in public health. It started in regs review, then it was pulled back and sent to public health as a way to kind of circumvent, I believe, that process. So I'm just putting this on the record that I think the policy decision it's not a good one. It just opens up the door for us to do this in any way that we want to. We don't want to go through regs review. So I would hope that people would do the right thing and make sure that this goes through the proper channels, which is regs review, have it reviewed and voted on there. Thank you, Madam Chair.
Thank you very much. The statute that you're citing, can you give me the reference to that statute, please? Because I do believe that statute references what agencies are required to do to repeal.
General statute.
Okay.
Section B is the one.
I have often said here, I am not a lawyer, and I see we do have a lawyer's hand up as well. I will just point out the regs review process would allow for editing and amending of the regulations. This is a repeal of the regulations, which is, it's two different pathways. Again, we've talked about that. Representative Carpino.
Thank you, Madam. I have a lot to say on this topic, but because of the late hour and the fact that I suspect I will see this again on the floor of the House, I'm going to save a lot of my comments, but I do think some are warrant saying here because I've listened for hours quietly. And I do want to thank the proponent of the amendment for making the motion, because I do think some things need to be clarified. For those who are unfamiliar, the reg review process and the committee is a bipartisan committee. The only reason that this committee, the Reg Review Committee, did not see these regs again is because the agency chose not to resubmit them. There was no stall. There was no delay on the part of the committee. The agency, whose job it is to put forward regulations that they are charged to do by virtue of the laws we pass in this building, failed to come forward again and resubmit. Now, I would never guess at motive, but I will say, as much as we have the authority and we have the obligation to set policy as members, it is very curious that the agency chose not to resubmit. It's now many months later. And yet here we have a proposal before us that they arguably had nothing to do with. While I take everybody at their word, I do find it very curious. That committee is set up long before I got here, and many of us in this room, to be bipartisan, I suspect for a very important reason. The Reg Review Committee is the last line in the sand to make sure that things get done right. There can be no delays when we are the committee that meets 12 months a year. So I am disappointed as a pro-choice Catholic Republican, and let me say it again because it's late at night, as a pro-choice Catholic Republican, that I have to vote against this bill because of the process and the items that are truly being removed, that are contrary in my heart to the public health of the women who make these difficult decisions. The fact that this is before us and we've had additional common sense amendments is disturbing. The amendment before you now is as clear as day. It is nonpartisan, it is non-political, and it is not even emotional. It is a straightforward opportunity for us to follow the procedures that have been set out for us to be exactly what we should be, nonpartisan and policy-driven. So, Madam Chair, I thank you for your time, and I'd like to thank the ranking member for bringing this amendment forward. I encourage all of my colleagues to support it.
Thank you very much, Rep. Carpino, and thank you for your approach and your the manner in which you shared your remarks. I really appreciate that, especially given the passion with which you approach this issue. One thing I will say, just as I will speak for myself, not for our co-chair, but the Department of Public Health did not approach us and ask for this repeal. I do want to put that on the record for whatever that's worth, but I understand that there are, I hear the concerns and frustrations that people have. And Senator Anwar.
Neither did they approach me, just saying.
Thank you. Is there further discussion on the amendment before us? Seeing and hearing none. It's Mr. Clerk. Mr. Clerk, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes no.
Representative McCarthy Vahey,
Carthy Vahey votes no.
Representative Belton, Senator Marks,
Marks votes no.
Senator McCrory.
McCrory votes no.
I didn't see you, Senator McCrory. I need to see you.
McCrory votes no.
Thank you. Senator Summers,
Yes.
Representative Claris Ditria,
Yes.
Representative Berger Javallo,
Berger Javallo, no.
Representative Biggins, Representative Carpino,
Absolutely.
Representative Daphne,
Daphne votes yes.
Representative D'Amico,
D'Amico votes no.
Representative Elliott,
Elliott, no.
Representative Jenga,
No.
Representative Gilchrist,
No.
Senator Gordon,
Yes.
Senator Hockedal, Representative Cavers DeGraw,
Davers DeGraw, no.
Representative Kit,
Representative Kit votes no.
Representative Kennedy,
Kennedy votes yes.
Senator Kushner,
Senator Kushner votes no.
Representative Mara,
Mara votes yes.
Representative Martinez,
No.
Representative Moran-Bella,
No.
Representative Parker,
Parker votes no.
Representative Paletta,
Paletta, yes.
Senator Rahman, Representative Reddington Hughes,
Reddington Hughes, yes.
Representative Ryan,
No.
Senator Slapp,
Senator Slapp votes no.
Representative Steinberg. Oh, wait. Oh, Senator Slapp, I didn't see you. Can you do that one more time? Sorry.
Sure, no problem. Senator Slapp votes no.
Yeah, thank you. Representative Steinberg,
Thanks.
Representative Steinberg votes no.
Representative Zepagis,
Yes.
Madam Chair.
Mr. Clerk?
28 total voting, 10 yay, 18 nay. Thank you.
The amendment fails. Senator Almar.
Thank you, Madam Chair. Madam Chair, I just wanted to make a quick little comment on the bill. And a conversation during the public hearing, I had been chairing when I had a conversation and discussion with the Representative Mara as well as with Representative Zepkis. So when you were talking about the regs, I was looking at the regs, what was in the bill. I wasn't aware that there were other regs that were supposed to be in the bill. So I spoke on what was in front of me, not knowing that there was a vision of having more regs in that bill. So I apologize, but I at least was not aware. So I wanted you to be aware of that I spoke based on my knowledge and information. But thankfully, during the course of the public hearing, it got clarified that there was more to it than we had initially understood. So I just wanted to put this on the record for you guys to be aware of. And thank you for recognizing that. Thank you. Back to you.
Thank you, Senator Almar. Is there further discussion on the bill before us? If not, I would like to say what I started with, which was to say thank you to each one of you for participating in the democratic process in this way. This has been a hard conversation for all of us. And I will share, maybe I'm oversharing, but it's 11, 12 at night, and I think you all know me to be pretty open. My heart hurts. It does. And I think that for the most part, the people around, everyone in this room, we share so many things. And I did hear what you said, Senator Summers, and the frustration that you have experienced in terms of the conversation. You hear me here all the time saying to be continued. And what I want and hope for is for us to be able to continue the conversation, even as hard as it is. Sometimes in our process, we tend to, on both sides of the aisle, certainly dig into things. And wherever we land today with this vote, I do hope to continue the conversation and to see how we can work together and if we can work together, but I believe that we can. So seeing and hearing no other comments. With that, Mr. Clerk, would you kindly call the roll?
Senator Anwar,
Senator Anwar votes yes on the bill. Thank you.
Representative McCarthy Vahey,
McCarthy Vahey votes yes.
Representative Belton, Senator Marks,
Marks votes yes.
Senator McCrory.
Yes.
I didn't see you on cam. Senator McCrory, can you do that one more time?
Yes.
I got you. Thank you. Senator Summers,
No.
Representative Claire DeStitria,
No.
Representative Berger Javala,
Gervallo, yes.
Representative Biggins,
Biggins votes yes.
Representative Carpino,
Carpino votes no.
Representative Dauphiné,
Daphne votes no.
Representative D'Amico,
D'Amico votes yes.
Representative Elliott, Representative Jenga,
No.
Representative Gilchrist,
Yes.
Senator Gordon,
No.
Senator Hockendahl, Representative Kavros DeGraw,
Davos DeGraw, yes.
Representative Kit,
Representative Kit votes yes.
Representative Kennedy,
Kennedy votes no.
Senator Kushner, Representative Mara,
Mara votes no.
Representative Martinez,
Yes.
Representative Morin-Bello,
Yes.
Representative Parker,
Parker, yes.
Representative Paletta,
Paletta, no.
Senator Rahman, Representative Reddington Hughes,
Reddington Hughes, no.
Representative Ryan,
Yes.
Senator Slapp,
Senator Slapp votes yes.
Representative Steinberg, Representative Zupkus.
No.
I'll go through the list again. Representative Belton, Representative Elliott,
Elliott, yes.
Senator Hockendahl, Senator Kushner,
Senator Kushner votes yes.
Senator Rahman, Representative Steinberg, thank you, Madam
Rep.
Chair. Oh,
Steinberg, you're muted.
I'll go.
I don't know if.
I
Rep-
didn't hear I didn't hear him.
Yep, Rep.
Can
Steinberg.
you hear me?
I don't see you. Oh,
We'll have to come back. Rep. Steinberg,
unmute.
you're
You're
muted
muted.
still. Okay, I think we're gonna have to come back to you, Rep.
Can you
Steinberg.
hear me?
We can hear you and we can see you, but not at the same time. Does that count in the rules? I don't know. I'm not sure. Well, Rep. Steinberg, we're gonna come back to you. We are going to leave the votes open for very briefly after the meeting. We'll let you know in a few minutes how long that is. It depends on how many of our members still need to make up the votes that they missed during the course of the day. Okay, with that, we are going on to item number 8. This is House Bill 7214, an act concerning maternal health. This is a JFS to the floor, LCO 6881. May I have a motion? Moved by Representative Kit, seconded by Representative Biggins. With thanks to Rep. Belton and Rep. McGee and the Black Maternal Health Caucus, and this bill establishes a perinatal mental health task force to address available perinatal mental health care programs, treatment innovations, and gaps in service, especially that address people of color, adolescents, and immigrants. It requires DPH to establish an annual maternity care report card to evaluate maternity care. DPH must establish an advisory committee to create the report card. It will adjust the scores to take acuity levels at various facilities into account, and the report cards will be posted on the Department of Public Health website. Finally, DPH will convene an advisory committee to study making hospitals more doula-friendly. The S language, which is mostly technical, replaces the language birthing people with pregnant and postpartum persons. Is there a discussion on this item? Senator Anwar, to be followed by Senator Summers.
Thank you, Madam Co-Chair. I just wanted to make a couple of comments on this bill. This is an important bill. Just to put things in perspective, why this is necessary, 1 out of every 5 deaths in the state of Connecticut from 2015 to 2021 were Black women. And more or less the same amount were Hispanic women. So that's like a far bigger share of maternal deaths from the population that these communities have. Nationally, the Black African-American women are 3 times more likely to die than their white counterparts. And in Connecticut, when the Department of Public Health looked at the maternal mortality in the state of Connecticut, 88% of the maternal mortality in the state of Connecticut is preventable. That is far higher number than the rest of the country. And when you correct the individuals for socioeconomic status, the maternal mortality for Black and brown women does not change significantly. If you adjust it for education, it does not change enough. And that tells us that the challenges are far more in the healthcare delivery system than what we have recognized. So if you look at the prenatal care, pregnancy care, postpartum care, and infant mortality rate, as a state of Connecticut, we have a lot of work to do. I just wanted to thank various organizations who have been part of these bills. I wanted to thank Representative Belton for her work and the entire group's work as well, including the Hispanic Health Council who have been working on this bill. So I just wanted to share that this bill is a very important part of healthcare issue that needs to be addressed. And while this bill is a starting point, it's definitely not the ending point, and we should definitely support it, but continue this conversation going forward. So thank you so much, Madam Co-Chair. Back to you.
Thank you, Senator Amor. Senator Summers.
Yes, thank you, Madam Chair. And I do think that this is an important bill. I think that we can do a lot more for maternal health, especially for our minority communities. I do just have to point out, because I find this complete hypocrisy here, that in Section 2, guess what we're doing? We're collecting data. We're collecting data on race, ethnicity, including, I can't read it here, income level. It's disaggregated data, but we're collecting data for that. But we couldn't collect data for the previous thing that we discussed. So I would like to make an amendment to delete the references to data in Section 2 of this bill. So we are equitable across all bills here. And I would ask that we take that in a roll call vote when it is called, Madam Chair.
Senator Summers, the amendment is, can you say your amendment again, specifically the lines?
It would be, so for lines 16, where the commissioner starts to identify and collect data necessary to complete the report card, which then includes all the way down to what line is that? 128.
Can you say the first line again,
Sure.
please?
It's 116.
116.
Actually, why don't we just delete that whole section, because it all has to do with data collection. And this is why data collection is important. But if it's not important for our previous bill, then I'm not sure why it's important for this bill. So I would like to delete that section so we are equitable between data collection. Again, I don't know why we're putting this out. No, it's the same thing. Okay, I'm going to withdraw my motion and then
You withdraw.
put in
the
a new
second?
motion to strike Section 2 from the bill. And when we vote on it, I ask that it be voted on a roll call vote, sorry.
So there's an amendment on the table to delete Section 2, and there's a second amendment made by Senator Summers, seconded Representative Clara DeStitria. Okay. Senator Summers, further comment?
No, I just don't know how this committee can say it's okay to collect data in one area and it's not okay to collect data in another area. So although I feel data collection is really important, just like I had expressed before, if we're not going to collect it to make determinations in one area, then we really shouldn't be collecting it in another area. Thank you, Madam Chair.
Thank you, Senator Summers. Not all data is created equal, number one. Number two, I understand the frustration, but I have the entire day tried very hard to make sure that we don't, and this did happen earlier and I tried to stop it. I understand the use of the word hypocrisy. I would reframe it, as I often do as a social worker. We are not consistent. As humans, we are not consistent. We are not consistent everywhere in statute. We are not consistent within our parties and between our parties. We are not consistent. That is absolutely true. I appreciate the frustration around the previous bill. This issue in particular, we know because of, yes, the data that we collected. We know that Black women in Connecticut today are dying at, I think it's 1.7 to 2 times the rate of white women who are giving birth. So I understand, again, and as I said in the last discussion, I understand the frustration, but I do not believe that the deletion of this section is helpful. And I would ask all of the members of the committee to oppose the amendment. Senator Summers.
Yes, I just wanted to point out that many of the things that are being measured are the same things that were being measured in the previous bill. And I would have to argue that if you look, and I know we've heard this before, that there's just a disproportionate number of minority women having abortions that we will now not be able to track either. And when we look through what's in here, we look at the level of care, the patients served, where they're being served, very similar data points to what was being requested in the previous bill. And I agree that not everything is equal, but tonight we are doing one bill after the other. So, you know, we just heard the arguments why we shouldn't be collecting data, why we should be treating everything equally. And that's why this amendment has been put in. Thank you, Madam Chair.
Thank you, Senator Summers. Rep. Carpino to be followed by to be followed by Senator Gordon.
Thank you, ma'am. I wanted to thank the co-chair for providing all of that information during his remarks, because I do think the statistics are important, which is why I was so disappointed before. But I support this amendment for a different reason. I think pregnant mothers who decide to keep their babies and proceed with their pregnancy should be treated the same as women who make the difficult decision to end their pregnancy. So if one group is not going to have information collected, then neither should the other. So where I agree with you that we aren't always consistent, in this case, I think we need to be, because the nexus is we're talking to women who find themselves in a similar situation, who make different decisions. So with that said, I support the amendment.
Thank you, Representative. Senator Gordon. Senator Gordon, you are muted.
Good. Thank you, Madam Chair. I'll speak on the amendment, and I might have quite a bit to say about this amendment, so I'll proceed accordingly. I think we have to take into account, I do not believe that striking this amendment would cause harm. In fact, one has to ask, what is it that this section, that's section 2, actually trying to do? And then the corollary question to that is, how is it actually trying to do that? And I reference very well-written testimony by the Connecticut Hospital Association. They do support sections 1 and sections 3. But section 2, they raised a number of concerns which I think are valid here. And I do agree with things that have been said relative to data collection. And again, if we want to collect data to understand maternal health and maternal death issues, that's certainly a valid public health reason, just as it was when we had our previous discussion. So I don't think that there's any inconsistency in the actions, but others have used the word hypocrisy, and I won't go there right now. I think that's already been discussed. But when we look at this, and I believe it is important to understand more about maternal health and maternal death issues, and certainly there is things that are looked into on that, it just strikes me that then this bill goes and tries to create a report card, and creates a report card with certain characteristics to it relative to pregnant women and women who deliver their babies, in a way that the Connecticut Hospital Association flags as concerning. And I think this is a real world issue, and we've heard before during this, I think now a 12-hour meeting, that we try not to make unintended consequences, but this section 2 readily would do that. And that is a serious concern to me. And I'll go through some of this section 2, because again, this amendment is trying to get rid of this section. And I think it is another common sense amendment. Unfortunately, a lot of common sense amendments during today's meeting have been shot down, and that can be noted at some later time. But this is another common sense amendment. And I take a look at this and I'm saying here, for example, the commissioner shall identify and collect any data necessary to complete this report card. That is so open-ended that we would have no idea what rational criteria would be used to create a report card, which really you would like to actually know that before you start creating a report card to know how you're going to grade someone or grade a hospital on, especially when it comes to understanding healthcare, where there's tons of complexities in that. And we would want to know. One of the things that gets raised, and I want to highlight this in the testimony by the Connecticut Hospital Association, is that they cite here that when it comes to equity scores and equity grades, that they're not aware of any current national consensus statement recommendations or even established guidelines that provide any type of definition of what is an equity score or equity grade for hospitals regarding maternity care for women who are pregnant. I tried to take a look at this as I was preparing for today's meeting, and I couldn't find anything either that any organization or even the federal government through Medicaid services actually does issue various what some call report cards on hospital systems to all varying degrees for medical care provided, does anything relative to equity score or equity grade, let alone that I could find any other state that does it. And I'd be interested if there's another state or United States territory that actually does. So it strikes me that what is an equity score and equity grade that could even be reliably used as a metric to compare hospitals when you're coming up with a report card. I think that is a good reason to not have this section and to support the amendment. I'm not opposed to necessarily better understanding what an equity score and equity grade might be for a report card, but we should actually do that homework and better understand that and define it before wanting to put that into law. That just raises a major concern, and it raises a concern, and I'll use the words that the Connecticut Hospital Association cited, quote, arbitrary rankings. That is indeed would be arbitrary. And if it's going to be that way and it's not a measured metric that could be reliably compared from hospital to hospital, then it defeats the purpose actually of trying to develop a report card that could be understandable to those in healthcare and in public health policy to make decisions, let alone what does a hospital do when it gets a report card? How is it supposed to measure that if it's not something that's standardized? And also it will confuse the public, very much so. That's been a concern that's been raised over the years, and I'm assuming folks are well aware of that who, when we talk about report cards for hospital systems, there's been a lot of criticism about report cards issued by the Center for Medicare Services, and there had to be changes over time to try to make those report cards better understandable, better standardized when you're talking about various hospital systems of different types and different locations. And even then, the federal government at times has had issues trying to standardize certain metrics in their own report cards that they issue out, so to speak. So I think that behooves us to be aware of that before we start creating certain report cards here that it's unclear what we're really actually reporting. And so again, to me, that would be a reason to support this amendment, to delete this section. We should actually do better homework and better understand what we might want to do with regards to equity scores and equity grades in a report card before, again, wanting to start mandating that by law. The other is that there's further testimony that's provided that, and I believe this is very valid by the Connecticut Hospital Association, that talks about qualitative data. And in this section 2, there is discussion here about wanting to establish quantitative metrics. I think that's readily understandable when we talk about quantitative metrics with regards to, especially when we look at healthcare. There are various outcomes data, treatment data, things like that. that one could try to quantify. And I think that's readily understandable, and many types of report cards and metrics do rely upon standardized types of quantitative metrics. I don't have a problem with quantitative metrics, although I at times have problems with how the quantitative metric data gets used or interpreted, and that's a whole separate issue that raises a concern about a report card. But then it gets into qualitative measures. And an issue is, how do you actually grade qualitative measures? By the very definition of qualitative, you can view that as, in one hand, scientifically meaning functional, but in the real world, many times qualitative gets into subjective data. And that's, I think, really what this is getting into, because it starts talking about getting experiences from patients and things like that. That's separate from a report card. You can actually get into Press Ganey scores from hospitals, which they get all the time, which get into qualitative, subjective reports by patients of their experiences. That's stuff already out there. Public can readily access that stuff. Hospitals get that stuff very much so on a monthly basis. I'm in meetings every month at my hospital that talks about various qualitative type of reporting to better understand patient experiences. But when you start using that as an actual report card to report on hospitals, that's a different story. I don't understand how this group that's supposed to be together for this advisory committee in Section 2 would even come up with something standardized like that, because things that get reported subjectively can vary all across the board. There are people who routinely ding hospital care just because they didn't like the food in the cafeteria. And I don't kid you about that. I see those reports. That has nothing to do with the care of a hospital. But yet those are the type of subjective and qualitative reports that could be fed in. And then you'd have to be making further subjective decisions about how you're going to rank that. That's very different from quantitative measures, where that can be ranked very readily, and then you can start getting into how you do that in a scientific way if you wanted. The Connecticut Hospital Association raises those concerns, and I don't always agree with them, but I do agree with them on this regarding Section 2. And that's a major concern when you're going to start issuing reporting like that. So if you're going to start giving reports that a hospital passed or failed, yes or no, similar to what, I don't know if Los Angeles still does this, but when I last visited, their restaurants had placards that rated them A, B, C, D. And usually you want to stay away from a restaurant that rated D. I would hate to see that with a hospital. Normally, if a hospital is going to be rated that bad, they failed many other things, normally by their accreditations and their federal designations. So I'm just concerned with regards very much so about this Section 2. I think that the Section 2 actually harms the bill. And actually will take away from what this bill is trying to do with a good intent, which is see what we can better do, yes, with data collection, public health.
Senator Gordon, I think you're muted.
No, I'm on.
Okay, good. All right, good. Just wanted to check. Thank you.
Yeah, can you hear me?
Yeah, now I can. Thank you.
Yeah, no, I didn't mute myself, thanks. But when we use this data, and yes, it's data collection for public health purposes, and in this case, for understanding maternal health and maternal death, when unfortunately that does happen, I don't think we should be getting into report cards, because again, that's going to dramatically muddy the waters and not provide anything clear. And then also, if you're going to give a report card to a hospital, what does that mean then? Is that going to be holding the hospital liable? Is DPH or some agency going to go after the hospital for having a poor report card, these recommendations that are given based upon it? There's a lot of uncertainty and a lot of subjectiveness in Section 2, and I agree with the amendment, which I'm speaking about, which is let's focus on what the goal of this bill really is. There are ways to get information to the hospitals with regards to improvement. Hospitals already do this through their massive accreditation processes nationally that they have to adhere to for all sorts of services, including maternal health, very much so. So I would agree with getting rid of Section 2 because I don't see it serves any purpose. And again, it would actually cause harm given the subjective way that it's set up and the vague way that it's set up. Focus on section 1 and section 3. Leave section 2 for another time so that can be properly thought through with more detail. And I bet you if you include the hospitals in on this as stakeholders more, you'll get some good information and feedback from them. And one can always get into if you really need a report card. But I would dare say you don't need a report card. There's, again, good ways to get this information to the hospitals. And the hospitals would certainly want to see the analytics of this data so they can use it for their own purposes to see what they can do to improve and take that into account with their accreditations they get nationally, which far supersede any state report card, quite frankly. So again, I speak in favor of this amendment to delete section 2. Deleting it takes nothing away from sections 1 and 3. In fact, it makes it better and doesn't complicate things, again, with a very subjective section 2. So I would urge my colleagues to focus on the section 1 and section 3 and leave section 2 for some later time when it can be better thought through with appropriate stakeholders. That would be a good way to achieve the goals and the aims of this bill. Thank you.
Thank you very much, Senator Gordon. I will say, we haven't really spoken about this as much as normal this meeting, which is this bill is definitely a work in progress and it's an ongoing conversation. I would invite you, Senator Gordon, I hope that you will be able to meet with the Hispanic Health Council, who has been the proponent of the report card. And I think that there have been a number of conversations with the Department of Public Health and with other stakeholders. I think the Leapfrog program, if I'm naming that correctly, if that's the right, with the hospital grading system, there was some conversation about perhaps reaching out to them and piloting. While certainly there is more conversation to be had, as is true with every single bill that we pass out on JF, most of our bills end up either going through another committee or needing to be amended or have a fiscal note, et cetera. So in this case, we have a bill before us that, proposes to look at this in multiple different ways. So thank you for your comments, Senator Gordon. Representative Dauphiné, you have been waiting patiently.
Thank you, Madam Chair. This question might be for you, but it is regarding the amendment. Do we know if this data is confidential?
This is a question for me?
Yeah,
The
I think
amendment?
so.
Well, this is.
We were talking about the data and the data collection, and I'm wondering if the data in here is confidential.
This is, I believe this is disaggregated data. I apologize. I am very tired. All data that's collected will have to abide. If there is identified data, this would have to abide by HIPAA. This data in line 21, it's disaggregated by race, ethnicity, and income level.
Thank you. I know that was the question earlier. And again, I'm the one that used the word hypocrisy earlier, and I'll use it again. The hypocrisy here is really appalling, in my opinion. And I would just say, in the name of equity, as the good ranking member stated, I will be supporting this amendment. Thank you, Madam Chair.
Thank you, Representative Dauphiné. Is there further comment on the amendment before us? If not, Mr. Clerk, are you up again? Mr. Clerk, would you kindly call the roll on the amendment?
Senator Anwar,
Senator Anwar votes no on the amendment. Thank
Representative
you.
McCarthy Vahey,
McCarthy Vahey votes no.
Representative Belton, Senator Marks,
Marks votes no.
Senator McCrory,
McCrory's a no.
Senator Summers,
Yes.
Representative Claire DeStitrio,
Yes.
Representative Berger Javala,
Gervaldo, no.
Representative Biggins,
Biggins votes no.
Representative Carpino,
Yes.
Representative Dauphiné,
Yes.
Representative D'Amico,
D'Amico votes no.
Representative Elliott,
Elliott, no.
Representative Jenga,
No.
Representative Gilchrist,
No.
Senator Gordon,
Yes.
Senator Hockenell,
Hockenell votes no.
Representative Carlos DeGraw,
Carlos DeGraw votes no.
Representative Kit, Representative Kennedy,
Kennedy votes yes.
Senator Kushner,
Senator Kushner votes no.
Representative Mara,
Mara votes yes.
Representative Martinez,
Representative Martinez votes no.
Representative Moran Bella,
No.
Representative Parker,
Parker, no.
Representative Paletta,
Paletta, yes.
Senator Rahman, Representative Reddington Hughes,
Reddington Hughes, yes.
Representative Ryan,
Votes no.
Senator Slapp,
Senator Slapp votes no.
Representative Steinberg,
Representative Steinberg votes no.
Representative Zupkis,
Yes.
Madam Chair,
Mr. Clerk,
30 total voting, 10 yay, 20 nay. Thank you.
thank you. The amendment fails. Is there further discussion on the bill before us? Seeing and hearing none, actually, I'm sorry, I do need to double check here on Zoom. Seeing and hearing none, Mr. Clerk, would you kindly call the roll on an act concerning maternal health? LCO 6881.
Senator Anwar,
Senator Anwar votes yes on the bill.
Representative McCarthy Vahey,
McCarthy Vahey votes yes.
Representative Belton, Senator Marks,
Senator Marks votes yes on the bill.
Senator McCrory.
Senator McCrory votes yes.
Can you do that one more time? Senator McCrory, I didn't see you.
Yes.
Thank you. Senator Summers,
No to flag.
Representative Claire Tetria,
No to flag.
Representative Berger Javala,
Berger Javala, yes.
Representative Biggins,
Biggins votes yes.
Representative Carpino,
Carpino votes yes.
Representative Dauphiné,
Dauphiné votes no.
Representative D'Amico,
D'Amico votes yes.
Representative Elliott,
Elliott, yes.
Representative Jenga,
Yes.
Representative Gilchrist,
Yes.
Senator Gordon,
No to flag.
Senator Hockenell.
Senator Hockenell votes yes.
Can you do that one more time, Senator Hockenell? I didn't see you.
Senator Hockenell votes yes.
Thank you. Representative Carlos DeGraw,
Carlos DeGraw votes yes.
Representative Kit, Representative Kennedy,
Kennedy votes no.
Senator Kushner,
Senator Kushner votes yes.
Representative Mara,
Mara votes no.
Representative Martinez,
Representative Martinez votes yes.
Representative Moran Bella,
Yes.
Representative Parker,
Parker, yes.
Representative Paletta,
Paletta, no.
Senator Rahman, Representative Reddington Hughes,
Reddington Hughes, no.
Representative Ryan,
Votes yes.
Senator Slapp,
Senator Slapp votes yes.
Representative Steinberg,
Representative Steinberg votes yes.
Representative Zupkis.
No.
Thank you, Madam Chair.
Thank you. Before I go on, I'm going to ask how many people here in the room need to make up votes that they missed earlier? Okay. I'm just trying to figure out, I think I'm wavering. I don't want our team to have to be here too late, but Mr. Clerk, I understand that you would like at least 30 minutes after the end of the meeting. Is that correct?
Yeah, that can work, yeah.
Is it possible to do a shorter time period just in order to help you with that?
I'm checking right now. I'll let you know. Yeah.
Okay, so you know what? We'll announce the definitive time after the next vote so that we make sure that everyone has an opportunity to vote while at the same time making sure that we're not keeping our team here later than they need to be. With that, we have come to item number 9 on our agenda. This is House Bill 7215, an act concerning problem gaming, and this is a JF to the floor. May I have a motion?
So moved.
Moved by Senator Anwar. Is there a second? Seconded by Representative Kit. This bill, which actually first was raised as a title, problem gambling, but was intended to talk about actual internet gaming, or video gaming. This requires the Department of Mental Health and Addiction Services to create a program for people impacted by internet gaming disorder, including prevention, treatment, and rehabilitation. It allows the commissioner to have our regional behavioral health action organizations provide services, and it allows the commissioner to charge a reasonable sliding scale fee for services. I know it's almost midnight and everyone does want to go home. One of the reasons why we wanted to bring this bill forward, recognizing the fiscal situation that we face, is that internet gaming disorder is a recognized mental health condition. It's identified in the DSM as a disorder warranting further study. So it is not currently diagnosable, but it's characterized by excessive and compulsive gaming behaviors that significantly impair personal, social, educational, or occupational functioning. And individuals who struggle with internet gaming disorder may experience symptoms such as preoccupation with gaming, withdrawal effects, loss of control, and continued excessive play despite negative consequences. Young adults are particularly vulnerable. Emerging research has also revealed a significant correlation between gambling behaviors and certain video gaming practices, particularly the use of loot boxes. And those of you who have middle schoolers or high schoolers probably know what those are. I share all of that because we want to make sure that we as a committee are continuing to raise this issue in awareness and to continue the conversation here today and going forward into the future. Is there discussion on the bill? Representative Kennedy, to be followed by Representative Reddington Hughes.
Thank you, Madam Chair. And thank you for raising this bill. I was a little disappointed to see the gambling portion of it removed, and we're just talking about gaming. Through you, so my understanding is internet gaming is playing video games. Is that correct to you, Madam Chair?
Yes, that's
Okay.
correct.
So I only bring that up because it's probably not apples to apples, perhaps, but we have esports that's becoming more and more popular, and esports is electronic sports, not to be confused with internet gaming and video games. And I only bring that up because to me, I think it's young minds, young adults that are impressionable. And so it's like we're talking about gaming, but we have these esports, which are competitive games online. So I just bring that up because I will, as much as I'm excited to see this, like I said, I'd like to see the gambling on it. I'd like to see more, do I dare to hesitate to say data on this? I hesitate to say that because, you know, esports is growing. Are you aware esports is? And it is actually sanctioned by the CIAC as high school sports. A little frustration of mine, but anyways, so I just only bring that up. Maybe they're not comparable necessarily, but it is still our kids in front of boxes and they're either video gaming or and then the other thing I just wanted to bring up, because I was at a gambling forum just last weekend, and it really is concerning, especially our younger adults that are, at least they're supposed to be 21 to gamble online. And one of the speakers was talking about a personal issue with his son, who ended up with raising a debt of over $8,000. And so I'd really like to see that part put back in here, or how we're going to. So I know it's a work in progress, and I really hope we can gather more information. We'll move forward with more in this bill. So I just want to bring that up, and I do thank you for your time. Thank you, Madam Chair.
Thank you so much, Rep. Kennedy, for your focus on this and your attention on the issue. Much like tobacco, which ends up before multiple committees, ours, finance, general law, there are a number of places. The gambling piece has really been general law and public safety. We focused here this way on a narrow focus with the Department of Mental Health and Addiction Services. That was part of the reasoning behind that. But your point is incredibly well taken. And one of the reasons why we have brought this bill forward is the connection between all of these activities. And I will acknowledge that the esports and video games can actually be a real positive for some young people. So the issue becomes when it is a problem or moves into that disorder territory. So thank you very much for your comments. And I look forward to talking more and learning more from you about this. Representative Reddington Hughes.
Thank you. My question has to do with the renaming of this, because I do recall, the gambling part of it. And there's a difference obviously between gaming and gambling. Not all gamers play for money. While children can become addicted to playing the game, it's not the same as gambling. And I'm afraid in the last session, we saw what inaccurately naming a bill can do. The veterans bill that required total and permanent disability to access the discounts for those became like an absolute nightmare because the intent of it was changed. And then we had to go back. So my question was, this started out as gambling and then it kind of migrated only to the gaming end. So what is the intent?
The intent is gaming. What happened is we screened the issue related to gaming, but gaming, gambling, I'm not the general law person. After we raised that initial concept and talked more about what it was, and also again, recognizing that the Department of Mental Health and Addiction Services for prevention with young people, the focus more on the internet gaming, not necessarily for money, to your point. So that was what was intended, which is what happened with making the shift in the title to make it match the actual intent of what we had talked about among our, I think, almost 300 items that we screened this year.
No,
Thank
I
you.
appreciate that. I've had psychiatrists that treat children in my district that really did reach out for the gambling end of it, because as discussed before, the kids get a hold of their parents' credit cards. There's no way to vet it online. And before you know it, it's out of hand and the poor parents don't find out until it's too late. So thank you very much.
Thank you, Representative, for that. Representative Clara DeStitria.
Thank you, Madam Chair. One question I had is, do you need an official diagnosis for internet gaming disorder?
So it is not currently an official diagnosis. What they call it is a disorder warranting further study. So it's still as yet to be an official diagnosis in DSM. The Diagnostic and Statistical Manual of Mental Disorders. I don't know enough to know exactly where it is in the process, how likely it would be to become an official diagnosis, but it's, I guess, as we say here in the committee, has been flagged.
Thank you, Madam Chair. And then I also see the fee. It said the commissioner may impose a reasonable fee on a sliding scale to participants. Do we have any more information on that?
No, and I would say this this bill is definitely a work in progress, because generally speaking, our regional behavioral health action organizations are not the ones who are providing treatment services. They provide programming in prevention, generally education. So I think, again, as we said here, we will, as a committee, now, as we're nearing the end of our JF time together, we'll have to prioritize which of the bills we will be able to seek and provide funding for. I don't, as is always the case, not all of the bills that we have will make it through. So I don't know that we will get there with this one. I think we want to try and continue to have the conversation, continue to talk about this with the department and with our regional behavioral health action organizations and see what steps we can take. But I expect that this bill would need modifications.
Thank you, Madam Chair. And my final question, if it's on, forgetting what it is now. It's gone. it was there and now it's gone. Oh, I got it. Madam Chair, do we know of any other states that have done a similar program?
No, I do not know. And that's a question I would need to ask.
Thank you,
Thank you.
Madam Chair.
Thank you, Representative Clara DeStitria. Are there any other comments? Oop, I gotta go back to the Zoom here. Senator Gordon.
Thank you, Madam Chair, and good morning to you.
One in this room there. Oh, good morning. Now we can say good morning.
Yep. One question, a couple of my questions have already been answered, which is this doesn't seem to yet be an official DSM diagnosis. One question I have is there an actual fiscal note on this? Because if it's going to establish a program, do we have any idea of the scope of this issue in Connecticut and what might be the number of people who might avail themselves of this program? Thus, do we have any idea of the cost, or is this something that will just have to go to Appropriations Committee to be sorted through in that regard?
This will have to go to appropriations. It doesn't yet have a fiscal note just per the process. So once it comes out of committee, it would make that journey and we would find out. But again, as I said to the good ranking member, this bill will need some modifications and adjustments and further conversation in order to see the light of day on the floor of the House.
And another question I have is where it talks about the Commissioner of Demas may impose reasonable fee. I'm not aware, but are you aware of any other programs that Demas runs where they would impose a fee for a program? I'm just interested in knowing if this follows some precedent they already do with some other programs, or is this something new for Demas to then potentially do a fee?
No, Senator, I believe so, but I'll admit, though I am a night owl, normally my memory isn't serving me as well at this particular moment in time, and we could find out more about that.
All right, well, thank you. I just was interested in with regards to that, and also have they done this before? Thus, they have guidelines of how they would follow. But thank you.
Thank you, Senator Gordon. Are there further comments or questions on the bill before us? Rep. Reddington Hughes.
I'm sorry. Through you, I just wanted to find out, in this bill, are they collecting data?
I don't believe that there is anything in this bill that does, but thank you for the opportunity to talk about our youth risk behavior surveys that we use in our communities to collect exactly this kind of data. That data is used very regularly to make decisions on programming, education, and services in our communities. Thank you, Representative Reddington Hughes. Any further comments or questions on the bill? Seeing and hearing none. Mr. Clerk, would you kindly call the roll on House Bill number 7215 and Act concerning problem gaming?
Senator Anwar,
Senator Anwar votes yes on the bill.
Representative McCarthy Vahey,
McCarthy Vahey votes yes.
Representative Belton, Senator Marks,
Marks votes yes.
Senator McCrory.
McCory's a yes.
I need you to do that one more time, Senator McCrory, sorry.
McCory is a yes.
Thank you. Senator Summers,
No.
Representative Clara DeStitria,
No.
Representative Berger Javala,
Zavala, yes.
Representative Biggins,
Biggins votes yes.
Representative Carpino,
No.
Representative Daphne.
Daphne votes no.
Can you do that one more time, Representative Daphne? I don't see you.
Daphne votes no.
Thank you. Representative D'Amico,
D'Amico votes yes.
Representative Elliott,
Elliott, yes.
Representative Jenga,
Yes.
Representative Gilchrist,
Yes.
Senator Gordon,
No to flag.
Senator Hockedal,
Senator Hockedal votes yes.
Representative Cavers DeGraw.
Cavers DeGraw votes yes.
Can you do that one more time? Oh, I got you. Representative Kit, Representative Kennedy,
Kennedy votes no to flag.
Senator Kushner,
Senator Kushner votes yes.
Representative Mara,
Mara votes no.
Representative Martinez,
Representative Martinez votes yes.
Representative Moore and Bella,
Yes.
Representative Parker,
Parker, yes.
Representative Paletta.
Paletta, no.
Can you do that one more time, Representative Paletta?
Paletta, no.
Thank you. Senator Rahman, Representative Reddington Hughes,
No.
Representative Ryan, Senator Slapp.
Ryan votes yes.
Thank you.
Senator Slapp votes yes.
Thank you. Representative Steinberg,
Representative Steinberg votes yes.
Representative Zupkus.
No.
Thank you, Madam Chair.
Thank you, Mr. Clerk. So I am going to announce that we have our next and final, likely final committee meeting on Friday at 1:30. I will ask that those who need to still vote, please stay on Zoom and raise your hand. You'll be called in the order that you have raised your hands. The votes will be held open for the next 20 minutes, and I will help support the clerk here so that we can move through this as efficiently as possible. I again want to say thank you to all of you for participating in the conversation today and for this robust and vibrant debate. And with that, we are in recess until 12:25. Yeah. And Rep. Jenga?
Yes, I just want to say thank you to you and your co-chair. And I'm grateful for the way you ran the meeting.
Thank you, Representative Jenga. I appreciate that. All right, everyone, drive safely, please. Take care.
Senator Marks, I'll take you next.
Yep, I think I just have one, the discharge bill.
Yeah, I think, yeah, you're only missing that one. How'd you like to vote?
Senator Marks votes yes.
Thank you. Senator Marks, you're all good.
Appreciate you, Peter, very much.
Senator Kushner, I'll take you now.
Thank you. I'm not sure. I think I missed a couple.
Let me I'm checking right now. I'm missing you for SB 750. How would you like to vote?
Senator Kushner votes yes.
Can you hear me? Sorry. Can you hear me? They
I
disconnected.
couldn't. I only heard you on one.
Yeah, they disconnected me. They disconnected the audio in the room. Sorry. So I'm missing you for HB 7158. How'd you like to vote on that one?
Senator Kushner votes yes.
Maybe for this one. This one. This one. Okay, you're all good, Senator Kushner.
Thank you.
Yeah, have a good night.
Have a good
All right,
night.
Senator Gordon, I'll take you now.
Yeah, I think I missed 3 of them.
Yeah, I'll look for it now. I'm missing you for HB 750. How do you like to vote?
750, I vote no.
I'm missing you for HB 7158. How do you like to vote?
I vote yes.
Okay, I was only missing you for those two. You're all good.
Did I vote on SB 1540? I didn't remember if I did or didn't.
1540. I have you as a yes.
Okay, so I already did. Okay, good. Excellent. Thank you very much. Have a good night.
And you too. Senator Huckadell, I'll take you next. I believe Senator Huckadell's next. Sorry, late night. I'm missing you for SB 7. How do you like to vote?
Yes, please.
I'm missing you for SB 1537. How do you like to vote?
Yes, please.
I'm missing you for SB 1539. How do you like to vote?
Yes, please.
I'm missing you for SB 1540. How do you like to vote?
Yes, please.
I'm missing you for HB 750. How do you like to vote?
Yes, please.
I'm missing you for HB 7158. How do you like to vote?
Yes, please.
I'm missing you for HB 7213. How do you like to vote?
Yes, please.
Wait for that one. Wait for that one. All right, you're all set. Senator Huckadell, have a
Thank
good
you.
night.
Have a great night.
Representative Steinberg, I'll take next. All right, I'll make sure you're not missing.
Just the one, I think. Second to last.
The second to last one, all right, I'm about there right now. HB 7213, an act concerning the access to reproductive health care. How do you like to vote?
Representative Steinberg votes yes.
Have you for maternal health? Okay, you're all set. I got you. You're all set.
Have a good night, Peter.
Yeah, you too. Senator McCrory, I'll take you next.
What did I miss?
I'm checking right now. Let me just check. I'm missing you for HB 750. How do you like to vote? And then I can read would you like for me to read the title?
Which one?
HB 750, Act concerning the Office of Health Strategies recommendations regarding the Certificate of Need program.
Yes. I'm a yes.
I'm missing you for HB 7158, an act concerning safety plans and discharge plans for minor patients. How do you like to vote?
Yes.
Okay, you're all set, Senator McCrory.
All right, thank you. Yep. All right.
Rep Parker, final man. I'm ready to take your vote, man. Let's do this.
My God, Peter, you're a hero.
SB 7, how do you like to vote, Rep Parker?
Yes. Yes.
It's SB 1537, how do you like to vote?
Yes.
Yeah.
SB 1539, how do you like to vote?
Yes.
SB 1540, how do you like to vote?
Yes.
HB 750, how do you like to vote?
Yes.
HB 7158, how do you like to vote?
Yes.
HB 7213, how do you like to vote?
Yes.
Yes. Oh wait, I have you. Okay. Sorry. Okay, I think you're all good. Have a good one.
Get home safe, Peter.
Yeah, you too.